Hello everybody, my name is Andreas Engert. I'm a hematologist from Cologne, Germany. I'm the chairman of the German Hodgkin study group and I'm certainly interested in Hodgkin's. So here at ASH in San Francisco this year, there were a number of very interesting presentations, new drugs, and there were also a number of interesting studies presented where ADCETRIS was involved. You might know that this is an antibody-drug conjugate targeting CD30 and that this construct itself is very active and effective in multiple relapsed Hodgkin lymphoma patients. Clearly this drug has been moved forward into second line and also first line. Also in the relapse setting there were a number of interesting combinations with chemotherapy such as bendamustine in order to improve the outcome in these patients. The combination of bendamustine plus ADCETRIS is very interesting and has resulted in a very high response rate in relapsing patients. Also in the first line setting there was an update presented showing that the longer follow-up supports the use of this combination with very high response rate, very good PFS and 100% overall survival. That's the combination that's currently being tested in a randomized trial termed Echelon-1. There are also a couple of interesting abstracts where ADCETRIS is being used to increase the response rate in relapsing patients or patients that are aimed to undergo high-dose chemotherapy. But I would say one of the major highlights of this meeting is the ATHERA trial where brentuximab vedotin is being compared with placebo. It's a setting of relapsed Hodgkin patients undergoing high-dose chemotherapy and autologous stem cell transplant. And these patients have a rather high risk to relapse, particularly in the first year after transplant. So that's the rationale to use drugs to consolidate the results of high dose, because if patients relapse in this setting, particularly in the first year, and that's the vast majority, their prognosis is really poor. So the high relapse rate of these patients after high-dose chemotherapy is really the rationale for giving additional treatment, and that was done in ATHERA. 16 cycles of brentuximab vedotin were compared with placebo in a total of 329 patients. The results demonstrate that ADCETRIS is really effective in this setting. The hazard ratio is 0.57, so that's a really meaningful outcome. What is also very, very interesting to see is that the median number of cycles given was 15. So that underscores the good tolerability and interest of the patients and the doctor really to stick to this treatment, to continue this treatment and increase their chance of staying in remission, not relapsing. So I think that is really a very, very interesting study, a very surprisingly good outcome, and it will change practice in the setting of post-transplant high-dose chemotherapy in Hodgkin's.